Started. And can you all see our screen share right now?
Yes.
Perfect. Alrighty, so my name is Morgan Gano, and I'm the Assistant Director of Admissions here at the George Washington University Milken Institute School of Public Health. I am joined today by Ayika Aluk. She is currently a student in our Master of Public Health and Maternal and Child Health program. She is going to graduate in a couple of weeks. She also sits on the executive board for our Public Health Student Association. And I also get the privilege of working with her on a daily basis because she's our graduate assistant in our graduate admissions office. So Ayika, being the expert in public health, is going to lead the discussion on what is public health, why we need public health professionals, what careers are out there, and then we'll kick it back over to me for an overview of admissions.
Okay. So what is public health? That's a common question people tend to ask and not really understanding what the field of public health is. And so public health actually promotes and protects the health of people and communities no matter where people live, where they work, or where they play. So for example, when someone were to go see a doctor, they're getting treated for maybe being sick. People in public health actually work to prevent people from being sick or people to prevent injuries in the first place. And so public health professionals are really around to promote well-being for people, encouraging healthy behaviors, and trying to help and give the tools to everyone to live healthier lifestyles. And so who's in public health? So public health is a wide range of people from all areas. So biology, your public policies, engineering, mathematics. People are really coming from all backgrounds because all of those specialties are important to encompass what public health is. It's really about sort of a lot of the communication, the knowledge, the expertise, and so there isn't one particular kind of person coming from one area and focused study. And so this video, wait, I wonder if it, yeah?
Yeah,
I think it's, so this video is going to talk about a little bit more on what I talked about and what public health is and kind of give you a little overview.
Can you all hear the sound? Can you all confirm if you can hear the sound?
We can hear sound, but no, we don't see any video portion.
Oh, they don't see it. So we're over here.
Oh, okay.
Perfect. Okay, so I think let's stop share.
Yeah, for a second.
Okay.
That's weird.
Should I get exit out here?
Yeah, so minimize this for a second and then play it from here.
Okay.
And then share this screen.
How do I share that screen?
So minimize that for a second. And then, sorry, technical difficulties. Share that screen. Yeah.
All right. Okay. And did it loud?
And then make it bigger. And then, can you see the video now?
Just widescreen, but maybe.
It's okay, perfect.
Okay, perfect. Yes.
Yeah. Good.
Can you hear?
Yes. Yes.
Okay, perfect.
Even before a child is born, a quest to ensure its long and healthy life begins. All over the world, public health programs work to improve the health and well-being of communities by identifying the risks that affect different people in different places at different stages of life and finding the best ways to minimize them. It's about giving everyone the best chance to lead long, healthy, fulfilling lives from the very beginning to the very end. A child dies every 3 seconds from infectious disease, but public health interventions can prevent this by promoting things like breastfeeding, immunization, and antibiotics. Where children die because they have no access to safe water or basic sanitation, public health programs can make water safe and conditions sanitary. Where research shows us who has the highest risk of developing certain conditions, public health applies it to the real world. It turns evidence into the advice and practical help we need to lead active, healthy lives away from danger. It helps us make the right choices and form the right habits that impact on our health now and long into the future. Poor health doesn't just cost lives, it costs money too. By preventing, detecting and treating disease as effectively as we can, public health can help to halt the spiraling costs of treatment, saving lives and saving money. Public health is about understanding the huge impact that our financial, social, and environmental circumstances have on our health, and reducing the differences between us to make us all healthier. It's about making health achievable in mind and body, at home and at work, by supporting individuals, families, and communities in the environments they live and work in. It's about working to ensure that no one is left out or left behind as we strive for better. Public health, preventing disease, prolonging life, promoting health for everyone at every stage of life.
All right. Share. And then we'll share.
Back to the PowerPoint.
Is it there? There we
That
go.
right there.
There we go.
Yep.
Full screen.
From current slide.
All right.
Great. So as you saw from the video, there's different scales in what public health looks like. So it could be in the programmatic side, so people who are in various communities implementing programs and interventions. It could be people who are interested in taking the research that people in those communities conduct and creating policies for those various communities. And so there's various sectors people can work when they are public health professionals. So there's local, state, and health departments. There's federal government organizations, academia, if you're interested in working in universities, the private industry, as well as nonprofits. Some examples of those could be for your local health and state department, it could be the DC Department of Health. Federal government could be your National Institutes of Health, your Centers for Disease Control and Prevention, Food and Drug Administration, and so forth. Academia could look like universities like George Washington University, for example. Healthcare organizations could be working in hospitals or maybe long-term care or hospice. And then the private industry can encompass pharmaceutical companies, health insurance companies, and then some of the larger nonprofits that people know of, like the American Red Cross, Planned Parenthood. And so there's various titles of people who work in those organizations. For example, someone working in the federal government may have a title of a public health analyst versus somebody who works in a nonprofit organization might have a title of program manager or program associate. And so really depending on what sector you work in will differ on A, the work you do, whether it's programmatic or policy oriented, or B, what your title could be. So public health impact. So at the end of it, how does it actually help communities? What are some of the things that is currently going on, and what is the impact long-term that public health is doing? And so this coming summer, this coming summer will actually be the first World Health Organization Global Conference on Air and Pollution in Health. And so climate change has been a conversation that's been kind of booming in the past couple of years. And so this conference will be sort of the first of its kind to talk about how to improve air quality and what are some things that the world can do to help combat climate change. And so a lot of people may not know, but air pollution itself claims about 6.5 million lives a year. And so really trying to get in between and intervene in that to sort of prolong people's lives over time. And so another thing is the National Institute of Allergy and Infectious Diseases, NIAID, is actually unveiling a strategic plan to create a universal flu vaccine. So this past winter 2017 was a bad flu season. And so this flu essentially would sort of be one time for all ages and all groups to kind of combat multiple flu strains and to prevent a pandemic from even occurring. And so this would be something new in the conversation because the strains vary per year and the flu vaccines vary per year. And so that's an idea of how that's helping sort of in the infectious diseases side. And then a lot of people don't know in terms of how racial and ethnic stigmas and anti-immigrant stigmas actually exacerbate health disparities. So where people live, economically what people make, the opportunities for people to find work can actually affect your health over time. And so people, you know, are great in terms of looking at some of those structural racism and the policies that are contributing to various health issues and health disparities across the lifespan. And so I'm going to hand it over to Morgan to talk about how to apply.
Yeah, so now you've learned a little bit about public health, what opportunities are out there, why there's a need for public health professionals. But in order to be successful in a public health field, you really will want to pursue a graduate education. And when you start doing your research, you're going to learn that a lot of schools of public health in the United States, as well as programs of public health, are on a common application, and it's called SOPHAS, S-O-P-H-A-S, and that stands for Schools of Public Health Application. It's just a common application. I don't know how familiar you are with it, but you will complete one application and you have the opportunity to send it to multiple schools. So that's the advantage of that associated with the application. So as an international applicant, we want to make sure you are prepared for what to expect from the application process. International applicants often are expected to demonstrate their English language proficiency. One way to do that is through, or two ways to do that is through internet-based tests, such as the TOEFL or the IELTS score, the left tile over there. That is one, those are avenues, if you take the test and provide those scores, that you can demonstrate your English language proficiency. Below that tile, you can see our minimum score requirements that we would require in order for you to be considered for admission. Also, we want you to be familiar with standardized tests. At the graduate level, admissions offices are looking for a standardized test score as a part of the application package. The most common standardized test is the GRE. Again, our range is about 50th percentile or higher. That's kind of what we're looking for a competitive applicant. But a lot of schools will waive that, or they'll take alternatives such as the LSAT, which law schools use, the MCAT, which medical schools use, the DAT, which dental schools use. So we're pretty flexible. We'll take other standardized tests, but it varies across the board which school you're applying to. Lastly, transcript evaluations. If you have earned credit outside the U.S., we and a lot of other schools will require foreign transcript evaluations. This is just so we can see the U.S. equivalency, like what grade you earned on a U.S. grading scale, and just have it translated. Since you would be applying through SOPHAS for a majority of the programs you might be interested in, WES and SOPHAS have partnered together where if you have a SOPHAS ID, you get a discount on the WES, World Education Services evaluation. So that is our preferred evaluation service, but our school will accept other evaluation services. So there's a lot of options out there. Also, before moving on, I want to let you know that there are waivers available for English language proficiency. If you've earned a degree in the U.S. or another country where English is the primary language and the language of instruction was English, we could waive that English language proficiency for you. And same for the GRE. If you've earned a graduate degree or higher, we would waive that standardized test requirement for you.
So our school, George Washington School of Public Health, is actually the only school of public health in Washington, D.C. And so there's a lot of different resources that are available to us and that are offered to students who attend the institution. We're structured by 6 different departments. And under the 6 different departments, we have about 30 plus concentrations that include master's levels programs, doctoral, as well as certificate options available. And so the 6 different departments are exercise and nutrition sciences, prevention and community health, epidemiology and biostatistics, health policy and management, global health, and environmental and occupational health. And so that can kind of give you an idea of the various concentrations that kind of are under that if you're interested in looking more towards and expanding on some of the programs that we do offer. And so we do offer other master's programs, but I will say our most common master's level type is the Master of Public Health, but we do have Master of Science programs as well as Master of Health Administration programs here. But I'm just going to expand on the Master in Public Health program structure. So it's a 45 credit program. 15 of the credits are core. So no matter what concentration you're in, you're required to take those classes. So they'll look like your intro to EPI, your intro to biostatistics, your intro to health policy and management, and so forth. You'll have about 12 credits that are geared towards your specific concentration. So if you're somebody who's in the concentration that's focusing on health policy, for example, you might be taking classes that are giving you data analysis, policy approaches to health, but it really specifically depends on your concentration and what those concentration-specific classes will look like. You have about an 8 to 9 elective credit range. And so the 8 to 9 elective credits are whatever you want to focus in. So for example, I'm going to use a health policy example again. So if I was somebody who was interested in health policy and I was really interested in climate change or environmental issues, I might take electives that are in the environmental and occupational health department to kind of gain some of those interests that I have. And so there's a 2-credit practicum. So practicum is a fancy word for internship, I guess you would say. And so essentially it's a 2-credit worth internship where you have to complete a minimum of 120 hours worth of work, and you can pursue those opportunities anywhere. So it could be in Washington, D.C., it could be anywhere in the States, it could be anywhere around the world. So it really just depends on your personal interest and kind of what career path you're wanting to go down and what you're seeking to do. And the last 2 credits tend to be your cumulating experience, which is similar to a capstone or a thesis. The structure of it, however, depends on you, your interest in the department that you're in. And so the cumulating experience could be for someone who's evaluating a program, who's piloting a study, who's implementing a program. So it really just depends on what you're trying to gain and kind of what you want that lasting project to be for you. Most of our classes are offered in the evening and the late afternoon evening to promote professional development throughout the day. And so a lot of people do work throughout the program or intern throughout the day. And the core curriculum itself is actually that 15 credits that you see could be offered all online. And we do take up to 12 transfer credits. So kind of keep that in mind. If you're maybe take classes at the graduate level somewhere else and you want to transfer classes, we do accept up to 12.
And also, before we leave this slide, I think across the board, if you were pursuing a Master of Public Health, an MPH, it does take about 2 years to complete full-time, 3 years if you were to do it at a part-time rate.
Yes, but you have up to 4 years to complete the degree, so.
All right. So this is kind of moving on to like GW specific, or we say George Washington GW, requirements, but again, it's really common across the board because it's a common application. I like to think of an application as comprised in 5 areas. It's your personal statement, your resume, your letters of recommendation, and then of course the transcript, your GPA, and then your GRE scores, or standardized test scores, or whatever options, or whatever you submit there. Again, as an international applicant, you would have the additional English language proficiency test scores, so the TOEFL or the IELTS, and you would need to do the foreign transcript evaluation for the transcripts. Depending on the program, there could be an interview. It's very few programs that have that interview. But yeah, kind of like that. Statement of purpose, our recommendation would be to address why you're applying to that school, why the program of your choice, and then why now. We like to stress tackling it that way. Okay, application deadlines. In terms of visa processing, we do recommend international applicants apply for the summer or fall start terms. Our deadlines are December 15th for scholarship consideration. International applicants have equal opportunity to receive our merit-based scholarships. So as long as you apply and submit your application by December 15th, you will be considered. The absolute final deadline would be January 15th, and that's just to ensure we get everything done before the visa processing.
Tuition and funding. So currently there aren't any set tuition rates, and so they really evaluate tuition every summer. Currently our cost per tuition credit is $16.60, and that can very well change depending on the summers that are coming up. So the tuition rate that you start in you will not stay in if tuition decides to increase or stays the same. And so we do offer merit-based scholarships based on your GPA and GRE scores. So to be competitive for that, I usually tell applicants, again, over the 50th percentile on the GRE, as well as over 3.25 on a 4.0 GPA scale, in terms of being competitive for those scholarships. In addition to that, though, we do offer assistantships, and assistantships could look like research assistantships, administrative assistantships, and teaching assistantships. And so they vary by department. So teaching assistantships, you'll be working with a faculty member to help teach and assist them in their course. Research assistantships, again, with working with faculty, but it really depends on grant and funding opportunities. And then the administrative assistantships are dependent on the department itself and from their budget. And so I always tell applicants who are interested in those opportunities to connect with the departments that they're interested in, because those opportunities are pretty much hired and facilitated through at the departmental level. I will say structured assistantships, such as getting tuition assistance and a stipend, tend to go heavily towards doctoral students. There are a few available for master's level students, but they tend to primarily go to doctoral students. However, there are plenty of opportunities for student employment at the master's level. So the role that I'm doing right now with admissions is through student employment, but there are opportunities, for example, to do research with a faculty member where they'll pay you hourly, and there's opportunities to be a teaching assistant where they'll pay you a monthly stipend. And so there are various ways that you can get involved with the institution and kind of get more experience and enhance on your professional development. Yeah.
All right, so that's kind of all we have for you all today.
Here's our contact information in Morgan.
Yeah, specifically mine is down below. You can always send any general questions to the Office of Admissions and Recruitment, but you all have now met me, so feel free to direct them directly to me. But yeah, at this time, any questions you have, we can get to the chat feature.
Yeah, let's go to the chat. Thank you.
Let's stop.
Okay.
And there we go.
Great.
And we can still hear you, so let us know if you just want to
do you have any
throw them out.
Okay.
I want to ask about degree, Doctor of Philosophy. In our country, it's another. We have no Doctor Philosophy. We have.
So which doctoral program?
So do you want to know our doctoral program offerings?
1 second.
It's just breaking up a little bit, so.
Я перекладу.
Може, я просто не все походу правильно зрозуміла через це.
А чому це?
Ну, яке має значення, що ти кандидат чи не кандидатом в резюме власне?
Окей.
Якщо.
Okay, it seems like we have no questions. I will explain it. Oh, it's me. Here. Okay. Okay, now you can see me. Thank you very much for the lecture. It was very interesting, even for me, but I'm far away from the house. But I hope that to all of other listeners, it was useful too.
Good.
Yeah.
All right. No questions?
No questions?
Okay, no question.
Thank you.
Thank you.
Yes,
Yeah?
thank you.
Thank
Have a good day.
You too.
Thank you.